Hello everybody, before begin, I introduce myself briefly. My name is Marina and now I working at University Binawan in Jakarta. Today, I'm going to talk about my research with the title The Correlation Between Compliance FA Tablets Consumption and Tea Drinking Habits with the Incidence of Anemia in Pregnant Women. The introduction. We know about the anemia caused by anatomical and physiological changes in pregnant women such as hormonal and hematological, and can be increased in plasma volume relative to red blood cells or hemoglobin and decrease in the absolute number of red blood cell or hemoglobin. The anemia looked at the hemoglobin and hematocrit concentrations decrease in the first trimester and the lowest point in the second trimester. The prevalence of anemia in pregnant women, according World Health Organization, there were 40.1% in 2020. In Indonesia, increased to 44.1% in 2019, according Riskesdas at 2018. In the Bogor city, there were 11.9% according Bogor City Health Office at 2020. Because of that, so the government has carried out health efforts for pregnant women by providing antenatal care at least 4 times during pregnancy and receiving a minimum of 90 iron tablets during pregnancy, and done simple laboratory tests like hemoglobin levels test. The objective of this study was to analyze the correlation between compliance, FA tablets consumption, and tea drinking habits with the incidence of anemia in pregnant women in the working area of the Gangkelor Community Health Center at Bogor City. The methods we use purposive sampling technique, and the design was quantitative research with an analytical observational design with cross-sectional approach. The research done at May to June 2023 and the place at the working area of the Gangkelor Community Health Center, Bogor City. The population were all pregnant women in the Gangkelor Community Health Center working area in January to May 2023. Totaling population were 417, and the number of samples obtained was 90 pregnant women. The inclusion criteria were residing in the working area of the Gangkelor Community Health Center and the carrying out an NC examination at the Gangkelor Community Health Center, pregnant women in the second and third trimester, and the pregnant women who have had a hemoglobin examination in the last 2 months, and pregnant women who receiving iron supplement tablets. And the exclusion criteria were pregnant women with serious illnesses and pregnant women who changed their place of residence. And the research instrument, we used questionnaire form for consuming FA tablets, and tea drinking habits uses the food frequency questionnaire. The result we see at the table 1 about the distribution of respondent characteristics based on age, education, occupation, and upper arm and circumference. We know that on the compliance FA tablets consumption, we get high the people as of 49 pregnant women, and the tea drinking habits consumption we can see rarely at 78 pregnant women. On the table 2 about the correlation between compliant FA tablet consumption with the incidence of anemia, we got p-value at 0.575, and the correlation between habit of drinking tea with the incidence of anemia, we got p-value at 0.072. The correlation between the complement FA tablet consumption with an incidence of anemia, the p-value, meaning there was no significant correlation between compliant FA tablet consumption with the incidence of anemia. This is supported by the research Helga et al., Aprilina et al., and Sarah et al., and Purnamasari et al. We know the compliance with the consumption of blood supplement is an important factor in treating anemia in pregnant women because by following recommendation for proper and consistent use, pregnant women can ensure intake the iron and other important nutrients needed to increase hemoglobin levels and overcome anemia, thereby helping maintain health maternal and fetal development. And we know about 95% of anemia during pregnancy is caused by iron deficiency. The correlation between tea drinking habits with the incidence of anemia about the p-value, meaning there was no significant relationship between the habit of drinking tea in pregnant women and the incidence of anemia, and this is supported by Mallory Lestari and Purwaningtyas and Pramaswari and Novelia research. The habit of drinking tea has become a culture for the world's population. In addition to water, tea is a drink that is widely consumed by humans. The average consumption of tea by the world's population is 120 milliliter per day per capita, as a Besra et al. At 2007. The habit of drinking tea in pregnant women can increase the risk of pregnancy complication and can interfere with the absorption of nutrients. Intake of vitamin C helps the absorption of iron in the body of pregnant women. The absorption of iron in the body due to pregnant women drinking tea before and after eating with an interval of 1 to 2 hours and causing a decrease of iron. The habit of drinking tea is at risk of experiencing anemia 2.785 times greater than pregnant women who never drink tea due to presence of iron absorption inhibitors that are often consumed by pregnant women, such as caffeine, tannins, oxalate, phytate, which can inhibit the absorption of iron in the body. These inhibitor substances must be avoided because these substances bind iron so that it cannot be absorbed, it be causing iron deficiency anemia. So the conclusion with the research, the location of the Gangkelor Community Health Center has the status of being a main health center by fostering 3 villages with population of pregnant women were 470. And the characteristic of respondents, out of 90 respondents aged 20 to 35 years, there are 73 people, most of them had high education. Compliance of pregnant women for FA tablets consumption had high 1 for 1 people and moderate compliance of 39 people and low compliance of 10 people. And the tea drinking habits in pregnant women were rare as 78 people and frequently tea drinking were 12 people. There was no significant correlation between compliant FA tablets consumption with the incidence of anemia in pregnant women with p-value as 0.575, and there was no significant correlation between compliance tea drinking habits with the incidence of anemia in pregnant women with p-value as 0.072. Okay, this is the result and conclusion about my research, and I hope this can be benefit to you all. Thank you and see you next time. Bye.